We talked about multi-unit level scan abutments. Now we want to talk a little bit more about implant level scan abutments. The difference between multi-unit level scan abutments and implant level scan abutments is that the multi-unit level scan abutment gives you the information according to the multi-unit. If you're using different type of multi-units, you can change between different types of multi-units from the same category, but you can't switch, for example, from straight multi-units to angulated multi-units because you don't have any information regarding the orientation of the hex. So if you took impression on straight multi-unit, you can't change to angulated one. But what happens if you don't know what type of multi-unit you want to use at all and you're using cadcam? In this case, you need to take impressions on implant level. The implant level takes you the relations of the hex inside the implant and the height of the implant. So theoretically, if I took impression on implant level scan abutment, I can choose to use different types of multi-units, angulated one and straight one. In example, for this case, we took impression with implant level scan abutment, but what I've wanted to show is the multi-unit on the implant level scan abutment can be angulated one. You can see the multi-unit inside the mouth, and it can be a straight one. You can see it in the modeling. So the one who will choose what type of multi-unit to use is the technician. The technician will see if it can be milled, what type of design is best for this type of case. In many cases, I'll tell you, the person who knows the best is the technician, because he can see it, he can see all the angles, he knows what type of multi-unit to use best for each case.
Why not to use implant level all the time?
If you use implant level scan abutment, on the one hand it's great because you can choose from all of the options, all types of multi-units. You can choose all the straight ones, you can choose all the angulated ones, you can change between them. But in here, the most crucial part is how you transfer this information from the technician back to the doctor, because sometimes the technician doesn't tell the doctor exactly what type of multi-unit he used. If you use angulated multi-units, each type of angulated multi-unit has 6 positions. So in here, those 5 angulated multi-units, only one was taken with implant level scan abutment. If we took all the 5, you have 5 times 6 positions.
30.
Yeah, 30 positions of different, right, of different positions of angulated multi-units. And even if one multi-unit is in the wrong place, the bridge in the end won't fit at all. And you don't know what from all these multi-units is the incorrected one. When you have 5 angulated multi-units and you take all the impressions on implant level scan abutment, each multi-unit has 6 positions. So all in all, you have 30 positions, 30 different positions with the multi-units. And even if one multi-unit is misplaced, the bridge eventually won't sit on those multi-units, and you don't know the problem where and which multi-unit is misplaced, and you just can't fit the bridge. So it's a great option, but you can't use it a lot because it gives you too many options for the doctor eventually. But all in all, it's great, and you need to do it only when you're not sure what type of multi-unit you want to use. If you're sure what type of multi-unit you want to use, for example, even if you know it would be a straight multi-unit, you can take on multi-unit level impression. Eventually, you can change the height of the multi-unit if you want, but take on the multi-unit level impression. In here, you can see the scan abutment. The scan abutment have the coordinations of all the multi-units. Each multi-unit in 6 different positions. So, yeah, the implant level scan abutment. So if you use the implant level scan abutment, you can choose between 70 degrees and 30 degrees multi-units. And if you choose, for example, the 17 degrees multi-units, you can then switch between the 70 degrees, or you can later switch to 30. You just need to tell the doctor to pass him this information so we could change it in the mouth. You'll just get lost when you try to position all the different multi-units in different places and you don't know where's the problem and you just don't know what to do. Here we can see that eventually the implant-level multi-unit that was taken, we chose to do on straight multi-unit to avoid the buccal bulge. And in the final restoration, in the design of the final restoration, you can see that the straight multi-unit with a smaller sleeve, the screw channel goes buccally and distally to T225, and the screw channel is invisible, so it's a great option in here to use the straight one. But in here, the only guy who can tell you what type of multi-unit to use is the technician. In here, the only person that can tell you what type of multi-unit to use is the technician, because the technician can see if it can be milled. If you can later design and manufacture this restoration properly. Because when you see the patient in your chair, you don't know what to do. You don't know what type of multi-unit. If you're not sure, and you don't have too many places when you're not sure, use the implant level. In here, what was done that we gave the technician the options to choose. You can collaborate more with your technician with the information that was sent to the technician. You have more information, you have more options. You just need to choose wisely what type of options you want to use, and don't give yourself too many options because you can get lost in so many options.
Thank you for being here today. Don't forget to like, subscribe and follow. Stay tuned for more and see you next week.